So we just wanted to kind of start with a bit of background on the secure data environment itself, kind of what is it and why are we doing all of this. So for the NHS Subnational Secure Data Environment Network, this comes about from something called the Data Saves Lives strategy, which came out like 3 years ago now, and is really kind of looking at how we use data in the NHS and try to do so kind of more safely. But since then, has very much kind of expanded into more of a regional offer that goes much further than NHS organisations. So forgive the overbearing NHS branding throughout this deck. Recognise that there's so much more than that. So a little bit about kind of what we're trying to do in terms of shift the paradigm with secure data environments. So the chief thing we're trying to do is move away from data sharing and move to data access, which feels like a really pedantic statement, but it's really important in that we're trying to prevent the need for research data to leave the environment in which it's held, and we're trying to keep it as close to source as possible. So traditionally, a lot of organisations, when they work with external researchers, might have to send a Excel document or a different type of document out via email or a different approach, and that makes it really hard for us to kind of control that data, to police it and make sure that it is being used for the right purposes. So SDEs kind of provide a virtual platform that allows us to kind of keep data in one place, that allows researchers to come to that data, and if at any point we decide that the data is not being used appropriately or the project's ending, we can just turn access off to that data. But it's also about kind of increasing the breadth of data available, so unlocking better research, deeper research, and kind of promoting collaboration across organisations that traditionally haven't been able to share data with each other. And for the kind of VCSE sector, some of the things that we think that can help enable is really greater visibility and in commissioning decisions, a kind of opportunity to really celebrate and showcase the amazing work that the sector does, and to evidence the kind of impact that it has on services like hospital or acute settings in terms of reducing activity there, but also kind of better supporting people and improving well-being. So that's kind of where we are, and our overall aim as an SDE is to try and support research that's kind of faster, fairer and safer, and ultimately improves well-being. So hopefully we're aligned on purpose. And aside from the kind of strategic aims, we also kind of want to help give access to the growing kind of research economy and what opportunities that has for VCSEs to leverage funding, as well as provide support in terms of research services, as well as access to kind of high performance computational infrastructure that researchers are increasingly demanding. And the other reason why we want to do this is because ultimately, as a Southwest region, we do receive the kind of lowest head investment per head of people in our region, and we want to change that. So we want to make this a really attractive place to conduct research. And we'll hear a little bit more from Andy about what our public think about this, but we've done a lot of engagement, and we're hearing kind of themes of SDs being reached to providing greater transparency, kind of greater efficiency, so reducing duplication in how data is shared, and ultimately that kind of sovereignty piece, people keeping control of their data and how it's used. So the secure data environment in the Southwest is a collaboration of lots of different organisations. So it is technically hosted in Bristol, North Somerset, South Gloucester Integrated Care Board, which is a bit of a mouthful. So NHS hosted, and it's a cloud-based platform, and that's where the data actually goes and is managed on the cloud. But it's jointly controlled by the other integrated care boards in the region, as well as Southwest Ambulance Service. So those are the organisations that make sure this data is kind of used and managed safely, and the universities are involved as our kind of delivery partners alongside lots of different other organisations. And apart from those kind of core leadership organisations, we do have about 50 different organisations that are already participating in the SDE. So a lot of those are acute trusts. We do have quite a lot of primary care sign up, particularly in the Bristol area, and increasingly community trusts. And recently ran a funding call, which also helped to support for voluntary sector organisations sign data sharing agreements with the SDE. So we are working in this space, but would really like to do a lot more. And that's part of the reason why we want to do this webinar today, to hear from you and also kind of help raise awareness on how you can get involved. So The SDE itself will go into kind of the detail in a little bit, but just want to say that we do already have lots of live projects. So this is not a kind of abstract idea. This is something that's real. It's already helping patients and customers in our region, and we want to do a lot more, and we want to kind of lean into that space with voluntary sector organisations. So what it actually is, chiefly it is a technical platform, but it's also a group of people that can manage that safely, as well as all the governance and legal arrangements in place to allow us to kind of use data for research. So we have support from the Health Research Authority to manage information which is identifiable, and that allows us to kind of link it together and create these kind of longitudinal healthcare records. And ultimately, that allows us to kind of use this kind of interesting technical-based kind of hazardous material box type model, where researchers come into the environment when their project's been approved, but the data never leaves and it remains in situ. And the way you request access to an SDE, and ours in particular, is you make a single inquiry into our team. If you're a researcher, they assess that research question, will help scope the research question. It will then go through a data access committee, which is including members of the public as well as others from the sector. And if that's approved, it's then kind of delivered technically. And we'll comment a little bit about how we do that. So that's kind of a bit of a overview of the SDE in short. Very briefly, how you can kind of take part in that. So if you're an organisation that wants to do a bit more research, is interested about how you can make your data available, but in a kind of transparent, ethical and safe way, then it's a relatively short process, although these steps require quite a lot of due diligence, which we can support with. So outlined, if you're a researcher and you want to access the SDE, it's pretty easy. You make your request. There's a lot of due diligence on that, but that's your route to kind of getting access to data that's already there. If you want to provide your data, it's a little bit more detailed. So we start off kind of understanding why you'd want to be part of the SDE, and in particular, kind of what data you'd want to share into the SDE that would then be accessed. Kind of what would be your research aspirations, so that we can kind of support projects that actually are important to you and have value to you. If we can find some kind of alignment in that, we then move to data sharing. So that involves a data sharing agreement with the SDE. So confusingly, this means that we're allowed to move data into the SDE, but as I said, that data will not actually leave that environment after, and researchers will come in to view that data. We then kind of establish an access request process. So the way we work is that we don't have a feed from your data, so we don't continuously take your data if you've signed up to the SDE. What we do is we review those projects that are coming through our front door. If a project requires your data, we need to have a process in place for requesting it. That can be manual, that can be automated, but we need to develop that so it's something that you're comfortable with, and ultimately means that you retain control of that data. And then we set that technical pipeline up. And then finally, it's down to kind of delivering that project. So whilst that's the last thing in the order of actually how we'd do it, often we start with organisations in working out what project do you want to deliver, what research do you want to deliver, and kind of work backwards from there to make sure that we're being purposeful. And we offer support through this entire process. So we have governance experts, you'll hear from Adam, as well as research managers that can help you scope up projects, as well as technical people to help that kind of data transfer process. And I think in the interest of time, I'll pause there. If there's time for questions, we can go into that operational model in a little bit more detail, but I'm keen to give my colleagues time on the floor as well. So thanks for listening.
Yeah, just a brief sort of discussion for you on some of the key points around information governance and ensuring that the data that is both shared into the SDE is safe and the data access via the SDE is safe. All of the SDEs across the country are following what's known as the 5 safes principle. And just to give you an idea of what that entails, it looks at a number of aspects. Firstly, it's safe projects, and that makes sure that the project that's been putting forward is one that is delivering a public benefit, has ethical support, etc. The research database within the SDE has its own ethical approvals, and so a lot of research can be done on the data that's made available to it without further ethics committees engagement. But obviously, if an organisation is bringing its own data, then it can go through an ethics approach on that basis. Key also is an element around safe people, ensuring that the people who access the data in terms of the research environments and the data sets they're given access to, as Henry has stressed, they are able to access the data, manipulate the data, they cannot remove the data. They must be properly trained, they must be authorised to handle the information, so there's a nationally recognised process all the SDEs are following to effectively register and approve the organisations that are asking for access, and also those researchers within them who are obviously taking part in the research itself. Crucially as well, there's the technical aspect around safe settings, ensuring the environment itself must prevent any unauthorized access to data, any accidental data leaks, and that's achieved through a number of reasons and methods. Firstly, the data, when it's extracted from an organization, lands within the SDE. It will only land in the format that is the minimum necessary for that research program. And so identifying factors we minimized as far as possible for that research program. And that's part and parcel of the whole sort of feasibility stage that Henry was describing, and then the data access request stage for researchers saying this is what I want to be able to do with data. We go through quite a lot of discussions and developments with them about what level of identity might they need to link records together. If they don't need to link records, do they need to know anything about the age factors of the individuals or the ethnicities or some form of geographical or issue related, let's say, to health inequalities, etc., which quite often is the case. And then we'll go through a process of what we call pseudonymizing the data. And so the data, when first extracted from the various sources that the research program will have, will in effect have a reasonable degree of identity potentially in there. The SDE has got National Confidentiality Advisory Group permission to effectively land identifiable patient data if and when that is needed. On the basis, then it will link it and then it will pseudonymize that data into data that is then not easily at all identifiable to anyone who can access it. That data then, once it's been prepared, put in place, and the approvals have been put in place, it will go into the trusted research environment for that research program. And so a researcher will only be able to access in the system the data that they are looking to access for their research program. If they are lucky enough, perhaps to be working on 2 or 3 research programs at the same day or facilitated through the SDE, they can only go into one at a period of time. They cannot link the data across multiple programs into one at that stage. So the access is very much segmented from that point too. Likewise, the whole process has a lot of information security built into it with trusted parties in terms of how the data is held, how the systems are put together, all the sort of standard information governance and data protection controls you'd expect around testing the networks for penetration testing, ensure that the data processors are subject to appropriate contracts and conditions to ensure they manage the environment technically properly for us, and all the cybersecurity issues you can think of are as addressed as far as they possibly and reasonably can be. I'd be a fool to say here everything's 100% secure, because no system ever is, but obviously an awful lot of time, effort and engagement is put into making that aspect of the system, as well as all the sort of process and people related aspects of the system, as secure as they can be. In describing that, I've actually covered 2 of the five safes, both the safe settings and the safe data at that point. But I also think very crucially, and one very much perhaps contentious issue at the moment, which the SDEs do not suffer from. Some of you may well have heard of the recent data breach through UK Biobank, where a large amount of sensitive, if not identifiable data, unique data to individuals, given the nature of it, was potentially available for sale on various Chinese website marketplaces. That happened on the basis that researchers were able to extract data from the UK Biobank. They were given permission and taking data out in its raw form from the database and then doing things they had agreed not to do with it. So several failings on that basis. The SDE, for example, we do not have a process by which the data can be extracted by the researcher themselves. If they want data outputs, and we put it as the 5th safe, the 5 safes of safe outputs, they can only get data out that has been through a data airlock and egress process, where the request looks at what they initially wanted to do with the data, how they initially intended to produce their outputs of tables, graphs, papers, etc., and aggregate information, and looks at what they produce within the SDE before any of that is released for their actual use within the papers and other things they wish to present. And so we'll be looking very carefully at the data before it goes out of the system to ensure no row-level data will go out in the system at all, and anything that does go out is illustrative, obviously, of the research question, but is there in terms of any issues around tables which have got low numbers in, for example. We would not allow to be released if it said there are these many of patients with this many conditions in this period in that time, and there's only 2 or 3. That sort of information would be blocked from going out. But the sort of aggregate numbers that say, I don't know, 2,000 patients in the last 12 months within the area of Bristol, for example, would prescribe this antipsychotic drug. That's nowhere near identifiable data, and obviously could be provided to the researcher to put into their research paper and program. So there's a very, very stringent and careful process, as we refer to it, as the egress of the data out of the system through an airlock, where it's checked by people who know what they're looking for and how they can take that forward. So examples of the sort of issue that UK Biobank, for example, suffered would not happen within the SDEs at that point in time. So a lot is put in place, a lot of approaches all the way through from the very beginning of the researcher asking for what data they may be able to access, all the way through to the endpoint when they can take the data of their analysis data, if you like, the outputs of what they've been able to run their tools and their analysis over in the SDE out of the system at that point in time. So the provision of privacy, confidentiality, and safe information security is paramount throughout the whole SDE process from start to finish. So hopefully anybody using the SDE, anybody actually providing data to the SDE as an organization, and very much an element of engaging with the public and patients as well about how they feel about the uses of data and taking that forward. So there is a lot of work, which others will go on to talk to, about the sort of patient engagement and participation side to ensure that the public trust this environment as well with their data. That's probably a few things in there that are useful to know about, but if there's anything more, obviously we can tick that up in a question and answers, but I'll pass on to others to cover other parts before we move into that.
Great, thank you, Adam. So we've run a series of 13 public involvement workshops. I've called them discursive workshops because we wanted them to be a place where people could really discuss the issues that this raises. So they were on average about 2 hours long, and we met over 150 people, and we recruited people through a variety of routes from across the Southwest Peninsula and from a diversity of social backgrounds and ethnic backgrounds, and we did collect some basic EDI data on that as we were doing them. A key question, overarching question we asked was, are you happy with the idea of people taking your data and bringing it together within the NHS to be accessed for other purposes than what it was originally collected for, planning, but mostly research? We discussed a number of key issues: cybersecurity, the 5 safes that you've just heard outlined, charging for access. This is something that we just wanted to run past people as a principle, because in the future we want to reduce the cost of running the SDE on the NHS, so we might need to charge for access, and how that will be done is yet to be worked out. We want to know how people would feel about that. We talked about how people get access to the Data Access Committee, and also that people who aren't happy can opt out of their data being used for via the NHS for being used for secondary purposes like research. We went through how you can do that. This is a summary of the things that we found. So people wanted to know about the secure data environment, and they wanted to know about how they could opt out, and they can opt out either via their GP or nationally via the NHS website. We had general public support for the SDE and the potential health benefits for the NHS from research. But there were kind of a number of conditions on that, that confidentiality is protected of people's individual data, data security is assured, research serves the public good and not for private profit. We will be undoubtedly at some points engaging with research that's got commercial aspects to it, but they wanted to be clear that overall it's the public good that really matters. Opt-out options are clearly communicated. People also wanted to know what kind of research their data was being used for. So transparency about the uses of the data. And one of the things that we will be doing is publishing the research that's carried out in the SDE and what it's found. And people did feel that it was acceptable in principle to charge to cover costs to help benefit the NHS. So these conditions really become the principles, our kind of social contract with people that inform everything we do in the SDE. Now, we don't say to public, we've had the workshops and just rely on us to do this now. What we've done is try to integrate members of the public into the governance and running of the SDE. So we've created what we call digital critical friends. So these are members of the public who've undertaken training so that they can be involved in the the Southwest SDE. So they've had training on exactly what is a secure data environment, what makes that different to other ways of sharing or transferring data for research, the 5 safes that you've just heard about. Secondary uses of data, so by that I mean obviously using data for purposes other than what it was originally collected for, including research, and the ethical questions that arise out of using data that people have as individuals consented to their use of. We recruited again from a diversity of people. So we've got, we originally started the project with a small group of 3 DCFs. We've now expanded that to 14 digital critical friends. They come from a diversity of gender, ethnicity, and geography. There's at least 1 or 2 DCFs from each ICB district across the Southwest Peninsula. And what we've done is work to embed them in each work stream of the SDE so that they're involved and informed in the decision making, with the crucial question of making sure that what we do is seen as socially acceptable by the people whose data that we are using. And they are also present on our data access committee. They make up a minimum of 1/3, so they're the biggest constituency. There's 6 people who are digital critical friends on there, and they're tasked with the particular question of making sure that the research that's carried out there has a clear public benefit and a clear pathway to public benefit, whether that be to patients, to general members of the public, to the NHS, or so on. So we're very keen, I'm very keen as leading this piece of work, to work further with various third sector organisations. I think it's really important that if those organisations are sharing the data with SD, that the people that are your members feel happy with that. We've done some work with underserved communities, but we're very keen. We need to do more of that. We've recently engaged with the Hindu community in Bristol. We've engaged with the community in Barton Hill, which is a particularly deprived area of Bristol. I'm currently in negotiations with the traveller community, the Roma community in Bristol, to do some workshops with them. And I'm also talking to a number of community groups in Exeter. So very keen to work with VCSE organisations to carry out further workshops, either because you may feel that you want to explain what this is about to your governance structures or to your members, so that they're happy about all this. And also, we do want to reach out to different diverse communities. We know that people's attitudes to these things, and indeed their degree of trust of research, it varies incredibly, and different communities have different questions that they may want to raise with us, and we're very, very keen to talk to those people and then incorporate those issues into the way we run the SDE, and also to inform the work that our digital critical friends do. I'll just finish by saying that this is not just a tick box thing. Our digital critical friends our first 2 pilot projects were selected by them. They've co-designed and presented engagement workshops. They've helped design our website. The principles that underline how we work have been developed with them. They are involved in issues to do with financial sustainability and access for profit companies to our data. And they've also helped design our approach to data access. So they've really had a big impact on what we do. But that's just to give you a flavour of how we've gone about working with members of the public to check whether what we do is seen as socially acceptable uses of people's data. And I'll finish there.